Good afternoon, everyone. I would like to start by thanking Isabel for this wonderful talk and also for her visit. It's so exciting to have this opportunity to exchange our ideas about research and also the work. I also want to thank Dean Bowman for the exchange program together with Public Health Ideas program and the Dean's office and all the support team to provide this opportunity for us to lead these public health ideas for creating healthy and equitable cities, to connect our excellent researchers within the School of Public Health to get or promote all the research together within the field of urban health. And this is our team. I was very honored to have this opportunity to team up with my dear colleague and friend Roshanak there. And this is a perfect moment for me and also for Roshanak to complement our research expertise together into this region about healthy cities. And like many of the other countries have developed many ideas about how to lead to more healthy, equitable, and even smart cities with the techniques more advanced. So this is right time to start with that within our School of Public Health. So last year we actually have our kickoff event, and before the event or during the event, we both Roshanak and I talked to many researchers in our not only my department, but also within other department in the school. And we noticed that there are many dots. Actually, most of us are working within the health-related research, kind of putting in the urban area. And now is good time or moment to connect all of them together. And I would also like to give a big shout out to Malika, who is our current program manager sitting right there, and also Jamison, who is our former program manager. And both of them have done tremendous work about those heavy lifting. Without them, all of this cannot be possible. And our goals for this initiative is to closely collaborate within the other departments and other institutions to identify and collect the important urban health data and promote the data sharing in urban health research. In the meanwhile, we would also like to develop or get new ideas for analytical quantitative methods for urban health research. During the last whole year, we have supported a few pilot projects in the urban health research. And this initiative support those researchers that are promoting or improving the knowledge for urban health challenges, evaluating the urban health programs or policies designed to improve the health, and also to provide innovative solutions to all the urban challenges. And we also try to expand the interdisciplinary research within this whole field. We also have other activities, for example, networking event. We have networking on the climate change, sustainable cities, environmental justice, also promoting the healthy aging in cities. Besides the research component, we also have created and also developed the Healthy and Equitable City course guide to guide or help our students who are interested in learning about urban health through a public health lens. And we provide the Healthy Cities certificates for them as well. One of the most important things we have done during the last whole year is to develop the Michigan Healthy City Tool, and this is based on the urban heart census for survey by the WHO. And we try to discover the health equity gaps using the benchmarks at the city and both the city and state levels. And that could help the local communities to use the evidence to take action on their priorities with the support of local and national authorities. And by using all of this Michigan Healthy City Tool, we would love to identify and prioritize the interventions to address urban health inequities. And this whole tool was leveraging the census data to expand the urban health research going beyond the Detroit area and to provide a statewide perspective for urban areas. And that whole tool includes the information from 7 domains: health outcomes, health behaviors, health care, housing and infrastructure, neighborhood and environmental exposures, the income and employment, and human development. So I just want to give you a big picture of what are provided within these tools, so you can, go ahead to use all of those tools and the data. So in this case, we actually have also the special modeling for all the cities, or actually 24 cities. We have 40 in-house indicators. For each one of them, you can have this geo-mapping, and to click, you will be able to click on each city or each census tract to zoom in and out and see what is happening within that area. And with that, I'm going to hand the floor to Roshanak to introduce some more details.
So just to give you an idea, this also came through conversations with various city officials, including Dearborn and Ypsilanti, who mentioned that they were interested in just better understanding what were the gaps across their city. And so what the tool is really, as Lu mentioned, is really meant to help identify areas or tracts within a city that are faring worse compared to benchmarks across, compared to all the other cities in the state. And so here you can see this is for Kalamazoo, where we've identified areas with higher prevalence of self-rated mental health, current smoking, unemployment, and such. And so we're excited to announce that as of today, you can access the tool. It comes with a manual that kind of better explains all of the different pieces that go with it. And our team is here to also work with communities and cities to develop methods, tools, dissemination around the data that they can produce and use for this work. And yeah, as I mentioned and Lu mentioned, our aim is to go beyond researchers, but also assist policymakers and community organizations for program planning and research. And as every new census data comes out, our goals are to continue updating the tool with new data. And just to show you where we've already engaged the data, we currently have 3 projects working on this, actually 4. The first one looks at social determinants of coronary heart disease and depression across the 24 most populous cities in the state. The Michigan, we're also using it in collaboration with MISHDA, which is the Housing Authority, to kind of look at the housing aspects and self-rated mental health. And we're working with folks over at the IFIP to look at the social determinants of gun violence. And that's it, right? Okay, so thank you.